Hello there. On behalf of the team, I'd like to thank you for this opportunity to share these important new data from the Ontario HIV Treatment Network Cohort Study, the OCS, at this critical conjuncture as we work towards flattening not just one, but two curves. This presentation, entitled Prevalence of Self-Reported COVID Infection, Household Exposure, and Frontline Work Among People Living with HIV During the COVID-19 Pandemic, is an attempt to examine gender, race, and occupation to assess the risks and exposures of COVID among people living with HIV in Ontario. I think most of us here will agree that the last 15 months have opened our eyes to an epidemiological and sociological convergence of an unprecedented scale. And I think it's fair to say that we still have a lot to learn in terms of assessing the simultaneous impact of HIV and COVID-19. However, what we do know is that the impact of HIV on outcomes of SARS-CoV-2 infection are hard to predict, with biological arguments for both poor and better outcomes. And there's a great commentary out there by Caroline Sabin at the AIDS Impact 2021 webinar. We are also beginning to see, thanks to observational data from around the world, various jurisdictions, that HIV is a marker for a group of people who have a range of social and biological risk factors. And that in Ontario, HIV disproportionately impacts people from Black communities, a group also disproportionately affected by COVID-19. While the lack of routine socio-demographic data collected by public health posed challenges at the outset of this pandemic, it is now unequivocal that overall racialized populations in Ontario are shouldering a disproportionate burden in the current pandemic. According to Public Health Ontario's Enhanced Epidemiological Summary, we know now with certainty, as seen by the illustration on the left side of the slide, that neighborhoods in Ontario with greater racial diversity, meaning those that have fewer and less concentrated populations of white people, experience a greater rate of COVID-19 infections. We are also seeing similar trends in Toronto, Canada's largest urban center. That is, emerging data suggests that overall white populations have been more protected from COVID compared to most racialized groups, with particularly high burden in South Asian communities. In response to the COVID-19 pandemic, the OCS implemented a new module to examine the impact of COVID-19 on people living with HIV. This module examined a range of factors, including the psychosocial impacts of the pandemic, COVID risks, and experience of COVID infection. The module was primarily administered remotely at 14 clinics across Ontario. So while the sample was diverse and reflective of the population of people living with HIV in Ontario, there may be some bias here, as some participants may have been actively sick or without access to a phone or internet, and therefore not able to complete the questionnaire. As you can see here, there are noticeably more males than female participants, and racialized people represent about a third of overall participants. Of the 1,167 participants who completed the COVID-specific module, 284 participants tested for COVID and 11 received a positive result. An additional 23 participants were told they had COVID, although they were not tested. It's also worth pointing out that COVID prevalence in the study at the time, December 2020, was similar to that in Ontario's general population. The overall numbers for people who tested or were told they had COVID were low in the sample, but there were some important trends. While males were more likely to test for COVID, females were more likely to test positive, live in a household where someone tested positive, or be hospitalized with COVID. It's worth noting that there was no difference between males and females if they were told they have symptoms of COVID. Last year, the primary public health strategy to prevent the spread of COVID was social distancing and self-quarantine. For many, this is not possible due to employment obligations that require people to work outside the home. Although people living with HIV have lower employment rates overall, many people living with HIV, particularly racialized women, were required to work outside the home during the pandemic. These individuals also worked in occupations with higher risks of exposure, including healthcare, manufacturing, and logistics. What's also noticeable here is that women, Black, and Asian participants were more likely to be working in these higher COVID risk occupations. Again, although the number of participants who tested or were told that they were positive was quite low, we can see trends that appear to be consistent with the general population and among other communities of concern in Ontario. For instance, immigrants were more likely to test positive or be told they had COVID compared to Canadian-born people living with HIV. People who worked outside the home were more likely to have had COVID. In the same sample, all Black participants who tested positive or were told they had COVID were women, and they had the greatest burden of COVID relative to any other group of PHAs. It's worth noting that still, non-Black women had a higher burden of COVID compared to men in the sample. I think it's fair to say that to flatten the curve, we need to focus on who is under the curve. These data suggest that OCS findings are consistent with trends in the general population, and that both in the general population and among people living with HIV, race, ethnicity, and gender are critical markers for differences in social risk factors, including occupation and socioeconomic status. What we have here is increasing evidence to suggest that HIV may be a proxy for a group of people who have a higher risk of SARS-CoV-2 infection due to the social, structural, and ethno-racial factors that put them at risk for both diseases. At the same time, additional study is necessary to better understand the interplay of co-infection of HIV and SARS-CoV-2 on the risks of COVID and the long-term health of PHAs. Racial, gendered, social economic disparities in SARS-CoV-2 infection mirror those found in HIV diagnoses. And lastly, these data suggest that people living with HIV, especially from racialized communities, experience the occupational exposures and risks known to drive COVID-19 transmission. I would like to acknowledge and thank the OCS team, our partners, and our participants. Thank you all, and take care.